Hi, and welcome back to the brand new baby course. I'm Dr. Jessica Zuba, pediatrician and co-founder of Be Well Pediatrics in Austin, Texas. And this is our second video in the brand new baby series. And today we're going to be covering week 1. So either you're getting ready to leave the hospital or you just left the hospital. Either way, you have a brand new human. So now what? It's pretty common for new parents to be nervous and be unsure they're not going to know what to do. But don't worry, you've got this. Evolution has your back. You as a human have been granted evolutionary instincts to help keep your baby alive and to know when something's not right. So keep that in mind. And babies also have an evolutionary instinct to survive and thrive, and they have instincts to let you know when they're hungry, when they're too cold, they're too hot, they need their diaper changed, they want to be held, right? Baby will let you know all of those things. The number one way is usually by crying, but that will get better as they get older. So hopefully as we work our way through this video course, you will start to feel a little bit more confident about being a new parent once you know what to expect and what to do. All right, so for today, we're going to be talking about weight gain, changes in bowel movements, and what to expect from wet diapers, and again, safe sleep. All right. So weight gain, like we mentioned before, it is normal for newborns to lose weight in the first 3 to 5 days, up to 10%, sometimes even 12% of their birth weight, and that's totally normal. And you might even be baby might even be losing weight at the time of their first pediatrician's visit, and that's still normal. But after those first few days, baby will start to gain weight, and what your pediatrician is going to look for at that 2-week visit is that your baby has regained their birth weight, because that's what we expect. All right, so other clues than weight gain that can clue you into that baby is getting enough milk or formula is going to be the number of wet diapers baby makes. So a good rule of thumb for pee diapers is number of pee diapers equals the number of days old. So the first day, those first 24 hours, baby might make 1 pee diaper, second day 2, third day 3, and so on to your losing count. And generally babies will make about 5 to 10 wet diapers in a 24-hour period. Yeah, we haven't even gotten to the poopy ones yet. And poopy diapers are also a good clue to gauge whether or not baby's getting enough to eat. So baby will usually have their first poop in the first 24, definitely by the first 48 hours of life. And that first stool baby has is called meconium. It's this thick, dark, tarry stuff that's usually a must to clean up. But pro tip, if you use Vaseline or Aquaphor as a diaper cream, it'll make it easy peasy to clean up. So little trick there. But as your baby starts feeding, getting milk, getting formula, those stools will usually transition to more of a yellow seedy consistency. And with formula-fed babies, we might not see that seedy consistency, and that's okay. Those little seeds are undigested fat from mom's breast milk. And over the first few days, again, the more baby eats, the more poops they will be making. And again, till you can't keep track of how many poops they're making per day. All right, and before we move on to sleep, I do want to talk a little bit about feeding and what to expect your newborn to do. So a good rule of thumb is newborns feed 2 to 3 ounces every 2 to 3 hours, or for breastfed babies, that might be 20 to 40 minutes every 2 to 3 hours. Sometimes babies might be hungry sooner. That's okay, feed them sooner. If they're, rooting around with their mouth open or wanting to suck on everything, those are good clues that baby's hungry. So feed the baby when they're hungry. Sometimes babies might, want to eat less or eat more out of feeding, and that's okay. When they're full, they'll pull away, they'll look away, they'll be disinterested. So really important to pay attention to those hunger cues and satiety cues, and that'll be really important as baby gets older and starts eating solid foods. All right, so now we're ready to move on to safe sleep again. Remember, safe sleep is boring sleep. So flat surface, whether it's a crib, a bassinet, or a co-sleeper attached to your bed that you can't roll over on, to baby is really important. Baby should be sleeping alone. The American Academy of Pediatrics recommends against bed sharing. If you're familiar with the Lecce League, they have different recommendations, but for the purpose of today's videos, we're going to be talking about the American Academy of Pediatrics recommendations. So nothing else but baby in that bed, again, alone. No pillows, blankets, stuffed animals, no crib bumpers, right? Crib bumpers are also SIDS risk or sudden infant death syndrome. So again, safe sleep is boring sleep. And those first few weeks, your baby doesn't know night from day. They don't really have their circadian rhythm that sets in until the first 3 or 4 months. So not only do they not know when it's nighttime, they don't really have a concept of nighttime. But there are some things you can do, and we'll talk about them in future videos to help clue your baby in to when it's time to be sleeping. All right, and then so one of those things is getting to a routine, right? So simple, easy routine for those first 1 to 2 weeks. Change baby's diaper, swaddle them. A lot of babies really love being swaddled. It reminds them of being all nice and cozy in the room and can be really relaxing to them. So while your baby's swaddled, you can feed them and then lay them down to sleep. Most babies will sleep again for a few hours at a time, 3 to 4 hours. For those brand new babies, you really don't want them sleeping more than 4 to 5 hours without feeding them. That's because they run the risk of hypoglycemia. So you and I as adults, our body, when we sleep, our liver helps break down our glycogen stores, which turns out into glucose, so our blood glucose can stay stable while we're sleeping. One, babies' livers aren't mature enough to fully function at that capacity yet, and two, they don't have those same glycogen stores to break down into glucose. So you want to make sure you're feeding your baby at least every 4 hours, no more than 5, but baby will usually wake you up before then and let you know they're hungry. All right, so setting some parenting expectations, right? Having a newborn is hard. It's exhausting because, again, they don't have a time clock. They don't have a circadian rhythm. They're hungry. They're cold. They're wet. All of the above, right? And they need you to take care of them, and that can be really exhausting. So you can love being a parent without loving every moment of it, right? You don't have to love those 3 a.m. feeds where you're just up at 2 with the diaper change. Like it's okay. And I think it's also really important for new parents to plan time for themselves. So whether it's getting help from your partner or a family member or a friend, so you can maybe have just half an hour to yourself to go for a walk, to take a bath, whatever it is that restores you, right? Making sure you have time for yourself on a regular basis can be really important. And then if you are feeling down and hopeless or anxious, you're not alone. It's a common thing that happens to new parents. But there are resources out there. There is help. So please talk to your doctor or your pediatrician if you are feeling this way at all. And I think that is it for today's video. So hope you guys enjoyed it, found it helpful. If you did, please share it with your friends, and I'll see you next time.